Assalamu alaikum and welcome back to Women's AM. This morning I'm joined by Sister Nusrat, Sister Hannah and Joyce Amoa to discuss endometriosis. Don't forget, if you have something to share with us on this topic, please do call in. The number is on your screen now, or you can tweet us at Islam Channel, #WAM15. So Sister Hannah, I'm going to come back to you now. Joyce mentioned before the break that this condition can cause infertility. So can you, this is obviously a huge issue for kind of women and families, so can you tell us a little bit more about this and how the condition can cause this?
Yeah. You know, it's not guaranteed that having endometriosis will cause infertility, but the chances, from what I've read, is definitely higher. You know, 30 to 50% of infertile women actually have endometriosis, so it kind of works both ways. It can influence it in many ways, you know, from the distorted anatomy, you know, of your actual pelvis, you know, scarred fallopian tubes, inflammation, you know, of the pelvic structures, you know, immune system functioning. So there's a variety of ways in that it can actually affect it, and I think that's why probably it's so hard to diagnose, because, you know, there's so many ways in which it's, you know, affecting your entire system.
Yeah. So, Joyce, what's your, you know, through your sort of work and research, what's your understanding of the infertility issue with regards to endometriosis?
Well, endometriosis, once it's early awareness, early screening, early medical intervention and early treatment does not necessarily have to lead into infertility. That is the message. Because if a woman is diagnosed early, they can be, their condition can be managed and they can go on to have a child successfully. However, if it's diagnosed late, after 35, then there are possibilities that a woman will be infertile, and also the risk of miscarriage is also high among that group. So if a woman is experiencing problem conceiving, then they should go for help early. And not, with our culture, we can resort to other means and really delay. So the important message is do not delay, seek help early, and also the awareness we must all pass the signs and symptoms of endometriosis on to our other women and also our children.
Absolutely. I think that's a really important message, actually, and I think, you know, particularly for us women, you know, when we're having a period, even if it's a particularly bad one, we tend to kind of just sort of soldier on through it and think, oh, it's normal, I just, you know, carry on doing this, carry on going to work. But actually, sometimes we should stop and we should go and get it checked out.
I mean, with endometriosis, pain is incapacitating. And any pain that stops you from performing your normal everyday function is not normal. And therefore, we ask women who are being incapacitated by extreme or excruciating period pain to seek help before it is too late.
And will endometriosis, will it be present at the beginning? So when you start your menstrual cycles, will it be there, or is it, how early would you be able to spot these symptoms?
There has been cases of young girls as young as 12 exhibiting those symptoms. So age-wise, any woman that have started their menstruation or periods are susceptible to developing endometriosis until, obviously, you get to menopause. Menopause is the ultimate cure, because there is no cure for endometriosis. It's a chronic condition that we need to understand, but it can be managed, and it doesn't have to incapacitate or destroy a family life or a woman's life or a woman's education.
And it's a progressive condition as well, so is it going to continue to get worse?
It can be a progressive medical condition if help or medical help is not sought earlier on.
Okay, so I think this idea of early diagnosis is key, and obviously once you know, the diagnosis has been made, there are treatments out there that can aid, that can alleviate the pain, that kind of thing. Sister Nusrat, can you tell us a little bit more about those?
In terms of treatments, yes, there will be treatments to relieve pain, prevent the disease, or at least manage it, or improve fertility or slow growth of endometriosis tissue. But in terms of deciding which treatment, your gynaecologist will normally discuss it with you, and there are factors when deciding which treatment to go for. So your age comes into it, how you feel about surgery, whether you've tried any other treatments before, whether the main symptom is pain or difficulty getting pregnant. So sometimes the treatments can even be goal-orientated. So if you want to, for example, have a child, your treatment will be to help aid your infertility. There's also, in terms of pain medication, you can take things like ibuprofen or naproxen. You know, there are other methods to try and ease the discomfort of that. And within painkillers, there are several categories or grades which can be stronger depending on the type of pain that you're feeling. Treatment may not be necessary if the symptoms are mild. So if you know that your symptoms are quite mild, it may not be within your best interest to take a painkiller that is very strong.
Yeah. So
it has to be adjusted according to the symptoms that you're facing.
Yeah. Okay, that's interesting. So a lot of it is around, you know, managing the pain and the symptoms.
That's right. So, I mean, before a woman obviously can categorically get a diagnosis, they need, as Nazra said, to be referred by their GP to a hospital to see a gynecologist. Now, there is a gold standard of diagnosing endometriosis, and that's a laparoscopy.
Right.
A laparoscopy is a procedure where a doctor will insert a laparoscope. It's like a camera, make a small incision around your navel area, and they will insert this camera into your pelvic region so that they can have a free access to see whether there are endometriosis adhesions, which can then be cut out.
Right.
But
so that would be a surgical procedure.
Yeah? It's a simple, straightforward surgical procedure. However, currently there are specialist centres. It's BSGE, which stands for British Society for Gynecological Endoscopy. They are accredited to deal with severe endometriosis cases. So depending on the degree or the stage of your endometriosis will determine whether you're operated on by a surgeon who is accredited or not. And in terms of treatment, as Nasra said, in addition to surgery, there are the various hormone treatment that can help a person and also pain relief. And there are also alternative approaches that, although has not been quantified, but some women report that they have found relief in alternative approach.
Yeah, I've heard a bit about this, actually, kind of alternative therapies being used, but obviously any treatment that anyone embarks upon, that's only to be done in conjunction with, you know, a doctor or a qualified medical professional.
And that's because what may work for one endometriosis sufferer may not work for the other person. So treatment is really intrinsic or tailor-made per patient, and therefore decision which treatment will work for you is something that should be determined between you and the consultant you are under, and obviously within the family circle.
Absolutely. So it's not like a one-size-fits-all kind of solution. It's very much, as you said, bespoke for your set of circumstances and how the condition's presenting itself within you. So that's really interesting there. Hannah, I want to come to you now. Obviously, we've been given a lot of information this morning, and as we've said, a lot of women are suffering with this condition. So what advice can we give? What kind of take-home messages can we give this morning?
I think, alhamdulillah, you know, as you said, it's been a very good discussion. It's been very informative. Something to take away, other than, you know, if you are going to pursue a form of treatment, or obviously, you know, contact, you know, a doctor or your GP, is to, you know, make dua. Obviously, if you're faced with this condition, because ultimately we know that Allah subhanahu wa ta'ala, you know, He is the one who has created everything in the world, and whilst creating, you know, these conditions, there's also there's a cure as well. And, you know, He Himself calls Himself Al-Muqeet, and the nourisher, you know, Al-Mu'eed, the restorer. You know, ultimately, we know after hardship comes ease. All of the things that we face in our life are tests and trials. You know, many sisters, especially if, you know, this condition does lead to infertility, they can become very, you know, subhanAllah, depressed, because obviously, you know, the thought of someone being childless is, you know, it is a very big test.
Of course.
But at the same time, you know, we must remember that we're just living in this world in order to get to the next one. You know, one step into Jannah, inshallah, and we'll just forget all of the trials and troubles we ever had in this world.
Absolutely.
And whilst we know that Islam places, you know, a very high regard, has a high regard for motherhood, that's not the only role that, you know, a woman can fulfill. We have the example of Aisha radiallahu anha, you know, and how she was just, you know, one of the greatest women who ever walked this earth, subhanallah, you know. We hear so often about her immense knowledge. She had recorded over 2,200 210 hadith from Rasulullah sallallahu alaihi wasallam.
So much that we can learn from Aisha radiallahu anha. And Joyce, very quickly, what's your final take-home message or advice to any women that might be watching who might suspect they suffer from this or who do suffer from it?
Right. Whilst there is no current cure, there are ways that one can, the condition can be managed so that you can go on to live a normal, successful life. So the message is early awareness, early screening, early diagnosis and early medical intervention. That is the ultimate goal we hope all women will attain to. And therefore, if we follow these, then the chances of being infertile or infertility is minimized. And therefore, you can go on to have a successful career, a successful motherhood, a successful family life.
Absolutely fantastic. So this early diagnosis really is key in terms of managing it and you know, living a pretty much normal life with it. So Jazakallah khair, thank you so much for that comment. That's very helpful. While there is no known cause for endometriosis, treatments are available to alleviate the pain and reduce the build-up in the body. It's not something to shy away from, and help is at hand and should be sought out. It's narrated by Abu Huraira, as recorded in Bukhari. The Prophet, peace be upon him, said, "There is no disease that Allah has created except that He's also created its treatment." We've had a great discussion this morning, but if you're just tuning in, don't panic, as this show will be repeated this evening at 11 p.m. And of course, you can catch the highlights from all this week on Sunday at 3 p.m. And now you can also watch your favourite episodes of Women's AM on YouTube. Here's how.